Welcome to Raportul de Gardă. We will be discussing today about the situation of cervical cancer prevention in Europe. Mr. Neil Datta, the Secretary of the European Parliamentary Forum on Sexual and Reproductive Rights, is with us today to present more insights into the subject. Thank you so much, Mr. Datta, for accepting our invitation.
It's a pleasure to be here with you.
So last year, the Cervical Cancer Prevention Policy Atlas was launched, and it provided an important perspective on the current policies in European countries. Please tell us which are the goals of this atlas and how was the research conducted?
Yes, so thank you for the question. So that's right. Last year we launched the Cervical Cancer Prevention Atlas, and it's an atlas that's essentially a map that scores 46 countries around geographic Europe, so that's the big Europe, including Russia, on how do governments do in terms of policies aimed at preventing cervical cancer and the related human papillomavirus. So it takes a look at specifically three areas. It takes a look at primary prevention, and by primary prevention, what we essentially mean is vaccination against HPV. Then it takes a look at secondary prevention. That's basically screening, a pap smear, etc., for possible cancer. And then very importantly, thirdly, it takes a look at online information, mainly from public authorities, to inform the public about the risks of cervical cancer and how to prevent cervical cancer through vaccination and screening. And so based on this, we did research into how all these 46 countries and their governments are doing in all these three areas, and we were able to see to score each government on the basis of each of these three areas. And based on this, we were able to see, for example, that 35 countries offer national routine programs on vaccination. However, it's only 17 of these countries that offer the vaccination for both boys and girls. A good thing, though, is that 31 countries offer a free vaccine, and also all countries, except Azerbaijan, for some reason, offer screening programs. So we're able to see all of this through this atlas, and it's a map where the good countries are in dark green, the bad countries are in red, and then you have orange and yellow and light green in between. And what we can see from this map is that we have 4 champion countries. They are Belgium, Denmark, Ireland, and the United Kingdom, who score very well in all three areas. At the other end of the spectrum, you have Romania, Bulgaria, and Slovakia within the EU, who are the worst performing countries, where there's very little funding for vaccines. The vaccines are only available to girls, and there's poorly organized screening programs. To find countries that are doing worse than Romania, Bulgaria, and Serbia, and Slovakia, you need to go outside the EU, and there you find Belarus and Azerbaijan, who are doing even worse. So already when you see countries that are doing better than you, you're able to ask yourself, why is that happening? Why are they doing better in my neighboring country than in my own? And you can start asking your politicians to start improving the situation. And we guide people in helping to do this by at least orienting them in 3 different areas: the primary prevention, secondary prevention, and the online information from public authorities.
So the fact that Romania has a lot to catch up when it comes to cervical cancer prevention, I think it was quite clear even from last year's public consultation on the Europe's Beating Cancer Plan, when Ursula von der Leyen actually emphasized the fact that a woman with cervical cancer who lives in Romania is 16 times more likely to die than a woman who lives in Italy, for example. So how is exactly Romania performing in the EU according to the Atlas? Which are the main challenges regarding primary prevention?
Yeah. First of all, as you pointed out, Romania is doing both absolutely poorly under its own terms, because Romanian women are dying from a cancer which is largely preventable if the right actions are put in place. It is also doing poorly comparatively to other European Union countries. So that's something to keep in mind. And as you pointed out, the Commission President Ursula von der Leyen basically highlighted that how well a person or a woman does in terms of going through an event of cervical cancer depends very much on where she happens to be born or is living in. And we see that in Western Europe, that's a much better situation. And then it gets worse the further east and the further south that you go. Now, in terms of, if we take a look at Romania specifically, out of a total possible score of 100, Romania scores only 37.4%. And now, what does this mean if we take a look at the three specific criteria? In terms of primary prevention, Romania only has a recommendation for vaccination, but does not provide enough sustained funding. There's not a well-organized national program, and at the moment, it's only open to girls. Separately, in terms of secondary prevention, Romania does a bit better, where screening is available, but it's not well organized into a coherent system available to all Romanian women who should be using this. And then finally, related to those two aspects of this, the Romanian government and public authorities are not doing enough to inform the public about the risks of cervical cancer and how this can be prevented through primary and secondary prevention, through vaccination and screening programs. And because of this lack of information, then there's a general lack of understanding among the public at large. So that means that even when these services may become available, they may not be taken up as much as they should be.
Romania doesn't have a national cancer control plan, an actionable one, which means that we have a lot of challenges when it comes to actually implementing cancer policies in all areas. Which do you think would be the most important, the top priorities for a national strategy to improve cervical cancer statistics in Romania?
Yeah, well, when we take a look at Romania and how it scores on this atlas, what we've come across is that there are two main challenges facing the country. One of them is about information and awareness raising of the public in general. And the second one is related to the bureaucracy of how things are organized by public authorities in the country. So first, in terms of awareness raising and information, as you know, there had been an HPV vaccination program that started over 10 years ago in 2008, but it was discontinued because it was very low uptake. And that's because many Romanians didn't know about cervical cancer, didn't understand that you can prevent it very easily through vaccination and screening. And so therefore, there was a very low uptake in the vaccination program when it was offered. So already there, that speaks to the need for the public authorities to come in and really play their role in educating and informing their own citizens. Next, a big challenge has been bureaucracy. So that now with the new HPV immunization program that just started recently in 2019, we understand that it's been rather bureaucratic in the way that it's organized, where there's a certain rather restricted number of young women, girls who are eligible. Of this group, the parents then have to make a formal written request to have access to the vaccine. These are then centralized at the family doctor, then higher up the medical hierarchy, and then the orders are placed and then delivered for the vaccines, for the immunizations. What that means is that what we've heard is that in many cases there can be a full delay of a year, if not more, between the original request and the actual delivery of the vaccine. Now, this is completely unnecessary. Romania, just like everyone else, is living in 2021. We don't need to organize things so bureaucratically. And if things were streamlined and simplified as they are in other countries, there could be a more healthy uptake and demand for the immunizations.
Could you mention some examples of good practices across Europe?
Yes. For example, in terms of good practices for that, you can turn to the 4 champion countries that we had identified. That is Belgium, Denmark, Ireland, and the United Kingdom. One thing that all of them have in common is that they have very good public information from public authorities about what is HPV, how does it contribute to cervical cancer, and how can you prevent it through vaccination and screening. So that's at the one level of public information. Separately, also, all of these countries have done a great deal of forward planning and made sure that there's enough vaccine supply and that these are easily accessible to the populations concerned. So that, from what we understand, even with the current vaccination program in Romania, there's only a certain restricted number of doses, which would only cover a small fraction of the population that could benefit from this. So already that's another aspect of to consider.
Let's take a look at the European opportunities to improve all the statistics. Which are the objectives of the EU Beating Cancer Plan regarding the HPV-related cancers? And what does this plan actually mean in terms of opportunities for the member states? How can Romania contribute more to these objectives?
Yeah, so the EU Beating Cancer Plan has at least the main thing to remember about the EU Beating Cancer Plan is its very ambitious target of reaching a vaccination coverage of eligible girls of 90%, so 90%. So that's very far from where Romania currently stands, which is at less than 10%. Another aspect of the EU Beating Cancer Plan is that vaccinations should also eventually include boys, and this should so that we're able to collectively reach a quasi-elimination of HPV related cancers by the year 2030. And the year 2030, it's only 9 years away. It's well within reach, even though it sounds a bit science fiction in terms of years. It's something we need to start planning for now. And basically, the EU Beating Cancer Plan, it's a call for sustainable and continuous access to vaccination and screening. So this speaks to member states' need to start molding and shaping their health systems in order to be able to gear up, one, for the increased vaccination requirements that will be expected, and then also to step up in terms of screening. So those are certain things to consider. Within another program, the EU for Health program, there's funding available to the member states in order to scale up in this way. For this funding to become accessible, like any EU funding, the request has to come from your government and your public institutions to the EU in order to then release the funding. So again, everything rests within Bucharest and the decision makers in Bucharest as to how it is to tap into that funding and to put in place the systems that are needed in order to contribute towards eradicating HPV-related cancers by 2030.
So one important goal of the EU Beating Cancer Plan is to improve cancer literacy. Is this all these projects on health literacy? In Romania, we had repeated failures with communication campaigns, as you mentioned, regarding vaccination and regarding screening. Mm-hmm. These are the reasons behind all this situation. What can Romania do to perform better in this area, in your opinion?
Yeah, well, unfortunately, all countries, all member states have faced challenges in terms of communicating to the public about health, and unfortunately, we live in a period of widespread disinformation in relation to health issues. The COVID vaccines and all of this are simply the latest version. But one thing that Romania can do is take a look at other member states and what have they done. Because if another member state can do it, Romanian decision makers and experts should be able to learn from that and say, okay, they were able to do this in member state X, Y, or Z. Our country is a little bit different this way, but still, we can adapt the lessons we've seen in other countries to the Romanian reality. So that's already one thing that they can do. The question is really generating the political will in Bucharest to spend the time to do this.
So how has the COVID-19 impacted into the HPV vaccination campaigns in Europe?
Yeah. Yes, the COVID-19 pandemic has been disastrous for HPV vaccination campaigns, but also for any vaccination campaigns that based on delivering the vaccines in a school setting, and that's for very logical reasons. The schools were all closed. There's over 800 million students around the world who should be in school but who are at home right now, and so it's had that impact. Now, when we were all faced with the first wave of the virus about a year ago, now we were all in a panic and we didn't understand things very well. So it's understandable that there was this halt in immunizations. But since then we've learned. So we should be able to better adapt to the temporary lockdowns and that we've all had to deal with. And also, as we learn, we can find ways of overcoming the loss of the normal immunization campaigns. At the same time, what we'll need to do in the next 2-3 years is to come up with systems to have catch-up campaigns for those who missed out on their regular vaccinations, including in terms of HPV, and it's affected all countries. So that, for example, in a country not far from Romania, in Greece, it's the Hellenic Pediatric Society that reported that there was a 45% fall in HPV vaccinations among young women. And even in very affluent countries such as France, there were 230,000 fewer HPV vaccinations in 2020 than in a normal year. So all countries are faced with the same challenges. We have to work collectively in overcoming those in the next couple of years.
Are there any other recommendations or messages you would like to mention regarding the Atlas?
Yeah, maybe just what I've said, just to reiterate what I said earlier, that that Romanians and Romanian decision makers are not alone in having to figure this out. But what is really required is for there to be political will to address this. And once there's political will in Romanian decision-making circles, then they can turn to solutions that have been found to work in other member states of the European Union, and then work on adapting them to improve the situation in the country.
Mr. Datta, thank you so much for all these messages. For more information on HPV-related cancer, on raportul de gardă.ro, you can find more information. Thank you so much.
Thank you.